I'm Mary Jane England, the president of Regis College, and I work very closely with the Harvard Pilgrim Healthcare to put together this leadership conference on health. And I want you to know that we personally talked to Nancy Pelosi and to President Obama, so they got everything done before this meeting today. It was quite extraordinary. For them to be able to use political, the way they did it was really incredible, and we are really very fortunate, and I think most of us probably in this room, since we already benefit from some kind of a universal access to health care in this state, are really thrilled with it. But it's very interesting, and the civil discourse in this country is just extraordinarily terrible. The things that people were called, the kinds of some of those talk radio people and other people, it's unbelievable to me. But then I remembered, as a medical student in 1962, I graduated from Regis in '59, so in '62 I was in medical school and went to a meeting of the Association of Medical Students. And a fellow from Stanford Medical School and myself were the only ones ready to give a minority report. And the minority report was on President Kennedy's Medicare and Medicaid proposal. And they were calling him, I'll never forget it, our enemy in the White House. And of course we know that a few years later, when Johnson came in, he could get anything passed. He was a very savvy politician. He passed Medicare and Medicaid, and it's the best thing that's ever happened to doctors. But the things that they called the president and everybody else on the Republican side was really extraordinary. And of course now they all want to protect it. And of course you all know the sad part is people say we don't want the government running our healthcare system, and we know that 65% of the dollars that fund healthcare in the United States today are federal or state. They're for state employees, municipal employees, all of the entitlement programs. So the whole notion that we're not going to, that the government's going to take over and make something really horrendous, it just isn't true. And it's really exciting, and I'm very excited about the people we've invited here tonight, and they're going to tell you more about it. But I just wanted to mention to you that there are some wonderful parts of this legislation. And for those of you who know anything about political process, you know that oftentimes we get the best things through in a crisis because the politicians, whether it's in this state or in Washington, seem to wait for a crisis. But the thing that's happened for those of us that are college presidents and work in higher education, that they attached to the health care bill the student loan bill. About 2 years ago, Senator Kennedy asked all of us in Massachusetts to what's called direct loan. We said, oh my goodness, Regis direct loan, we're not banks. We took it on, we do it here at Regis. They passed that piece of legislation, and the Pell Grants, which is the grants that come to our students below a certain level, have been raised. And that's $36 billion is going to the Pell Grants. So attached on at the 11th hour or whatever was the student loan bill. And so that's a big plus for those of us in higher education and for those of you who know how important Pell Grants are. So that's some of the background, and of course we saw the president sign it, and we know that there's still more politicking going on, but the major part of the bill is through. So tonight we have the opportunity to hear from some people who have been really involved in the issue here in Massachusetts and have been watching what's going on in Washington.